All right, so this is your lecture video for chapter 13, which is on drugs for muscle and joint disease and pain. So, joints and muscles. So your joints are the junction between two or more bones of the skeleton. Ligaments are non-contractile connective tissue that ties one bone to another. Muscles are an organ that produce movement by contracting. Your tendons are tough cord-like tissue that connects the muscle to the bone. So your ligaments are a non-contractile, meaning they do not contract. They're connective tissue that will attach one bone to another. Your tendons are tough-like, cord-like tissues that actually connect the muscle to the bone. So types of muscle, you have skeletal, smooth, and cardiac. Your skeletal muscles are voluntary control. Contraction is used for movement and maintaining posture. Your smooth muscle is involuntary, so it's found in the lining of your organs, such as your stomach, your esophagus, your uterus, and your bladder. And then your cardiac is an involuntary as well, and it's used, one example obviously for the cardiac would be the heart muscle. So muscle relaxants, okay, so a lot of times if we pulled a muscle in our back or any other part of our body, they will prescribe muscle relaxants because they will block normal muscle function. Because they're blocking the release of ACH, which is acetylcholine. So the acetylcholine is a neurotransmitter that is responsible for smooth muscle movement. The muscle relaxers actually block that. It prevents the destruction of acetylcholine at the nicotinic receptors, and it prevents the acetylcholine from reaching those receptors. Muscle relaxants do act centrally, which means they will be absorbed and distributed throughout your entire body, so it doesn't directly relax a specific muscle. It kind of does everything. Okay, it can depress the central nervous system, reducing the anxiety that increases muscle tone or the signals that can cause the spasms. Baclofen is probably one of the most common muscle relaxers that you'll see. It does act centrally. Lioresal is the brand name. It does come in an oral and an injectable version. You don't want to use it for long periods of time and just abruptly stop because it can cause some withdrawal symptoms. Soma is a controlled substance. This is a controlled substance because of the abuse potential. It does work or act centrally throughout the body. It is on the Beers list, which means use caution with alcohol and other central nervous system depressants. Cyclobenzaprine is also known as, the brand name is Flexeril. It is also acts centrally. Most of the muscle relaxers are on what they call the Beers list, which is a list that they compose that is a high risk when you use with alcohol or any other depressants. It can cause overdoses because it depresses the whole entire system centrally. Diazepam is used as a muscle relaxant as well. It's also used for anxiety and other things. It is a benzodiazepine, so it is a controlled substance. It does act centrally, so it can cause drowsiness and fatigue and kind of have that hangover effect. Metaxalone also works centrally. It is not a controlled substance, but it does have some very drowsy side effects that can affect your ability to operate heavy machinery. It can inhibit your ability to drive a car, that type of thing. So types of pain, you have somatic pain, which is a dull throbbing pain from a skin, muscle, or bone. Visceral pain is a sharp stabbing pain that would be from the organs. Again, remember, pain is a signal that something is going wrong or something wrong is within the body. But if you've had surgery or things like that, pain is a necessity for the healing process. So non-narcotic analgesics, okay, so analgesics means pain relieving. Non-narcotic means they are not controlled substances. They work by relieving the pain because they're interrupting the pain pathway. So pain is actually a result of the body producing prostaglandins. So you're going to want to know that. You're going to want to write that down. Remember that. You will see that on your final exam. So again, your pain is the result of your body producing prostaglandins. NSAIDs, so your non-steroidal anti-inflammatory drugs, so things like ibuprofen, Advil, aspirin, those are non-steroidal anti-inflammatories. They are analgesic, which means pain relieving. They are antipyretic, which means fever reducing, and they're also anti-inflammatory. So they fall into 3 drug classifications. Analgesic for pain relieving, antipyretic because they are a fever reducing drug, and then anti-inflammatory because they actually work to reduce inflammation. Acetaminophen, which is Tylenol, only is falling into 2 categories. It is an analgesic, so a pain reliever, and antipyretic, which means it's a fever reducer. Acetaminophen or Tylenol does not reduce inflammation. Salicylates, this is what you get like aspirin from, okay? It not only has an analgesic property to it, it does have anti-inflammatories and also antipyretic. You can take aspirin to reduce a fever. So the lethal dose of aspirin is 10 grams. Aspirin should not be given to children because of the risk of Reye's syndrome. It's important to watch combinations of drugs when you're giving aspirin, you know, the aspirin especially, but the other NSAIDs do have blood thinning properties to it. So it's important that people stop taking NSAIDs and particularly aspirins at least 7 days prior to any surgeries. Let's see. So mixed analgesics, okay? So mixed analgesics means they have a combination of a narcotic, so usually an opiate, with either an NSAID or acetaminophen, which is Tylenol. So examples of that would be like Percocet. Percocet is a combination drug. It has oxycodone, which is the narcotic, and then it has acetaminophen, which is the Tylenol. So it has both of those drugs in there. There is a potential for additive nephrotoxic effects. There's dosing concerns. More often the concern is about the narcotic dose. It's important to check the non-narcotic dose as well. So there's only a certain amount of NSAIDs dosing, so Tylenol, ibuprofen, and then Tylenol that you can take in a day. There's a certain limit on that amount. So when prescribers and pharmacists are checking the dosing of someone getting Percocet that has both the narcotic and the non-narcotic drug in there, both doses have to be evaluated to make sure that they're not overdosing on the narcotic side and they're also not overdosing on the non-narcotic side. Alcohol use with mixed analgesics is not a good idea. It increases the risk of liver toxicity, especially when the drugs are combined with Tylenol. And then there's an increased risk of GI bleeding when the drugs, alcohol is mixed with the mixed drugs that have the narcotic and NSAIDs in it. So osteoarthritis is a degenerative joint disease in which cartilage in the joints becomes thinner and less elastic. It causes the bones to wear and become deformed. The joints affected, so typically the joints that are carrying the large loads, so like your knees, and then your joints that are under higher amounts of stress, which would be like your fingers. So signs of osteoarthritis include morning stiffness. You start to get a progression of pain, limitations in the motion, and then a physical deformity of the joints. Goals of therapy for osteoarthritis is to reduce the symptoms, which help to prevent the disability that ends up associated with osteoarthritis. Treatment for severe OA is surgery and joint replacement. So you've heard of knees and hip replacements. So that's another option. They actually remove the bone and put in a metal knee, artificial knee, to replace that. So non-pharmacologic therapy, obviously the use of heat and cold packs, so hot and cold, using massage, and then periods of brief rest. Tylenol is a first-line medication for mild to moderate pain. It is useful in patients for whom aspirin is not recommended or is contraindicated in. It does cause, sorry, my kids are distracting me. So acetaminophen is a component of hundreds of hundreds of different prescription and non-prescription drugs. When it's used correctly, Tylenol is actually remarkably safe. However, when it's taken in doses that are above the recommended levels, it can cause serious liver damage. In fact, acetaminophen poisoning has become the most common cause of acute liver failure in the United States. And that's for a couple of reasons. A lot of people who are abusing prescription opiate combinations like Percocet or Vicodin, they're having to take a higher amount of pills to achieve the high, and that increases the amount of Tylenol that they're taking. So they're getting a liver toxicity out of the increased amount of Tylenol. Let's see. Liver disease. So your Tylenol is heavily metabolized in the liver, and that's where the overdose occurs. It shuts down the liver basically. So again, the patients who are overdosing on the either Tylenol by itself, that's one of the reasons why the childproof caps are necessary for over-the-counter bottles, so children especially don't get into the Tylenol. But for patients that are using any type of combination therapy that has Tylenol in it, is to be aware of the amount of Tylenol that you're taking in a single day. Non-steroidal anti-inflammatory drugs, your NSAIDs, they inhibit prostaglandin synthesis in the tissue. So again, pain is a result of the production of prostaglandin. This is a first-line therapy in any inflammatory disease process or any inflammatory situation that's happening. So osteoarthritis, sprains, strains, anything like that. It's important that you take NSAIDs with food, even a little bit, a couple pieces of bread, a couple pieces of crackers before you take NSAIDs. You should never take ibuprofen or anything like that on an empty stomach, as it can cause ulcers and actually bleeding because it eats away the lining of the stomach. So another non-steroidal anti-inflammatory drug is known as Celebrex, is the brand name. It works because it selectively inhibits the COX-2, which promotes the production of inflammation-causing prostaglandins. It does not inhibit the prostaglandins that protect the GI lining, so it's specific, does not affect that, but it does target the rest of the prostaglandins that are producing the inflammation. They use it for arthritis and other pain in which patients with a history of ulcers or have GI bleeding. Side effects is GI upset, fluid retention, potential for cross-reactivity in patients that are allergic to sulfonamides, and it may increase cardiovascular risk. Although it is not associated with cardiac complications, patients should still be monitored for this. So rheumatoid arthritis, or known as RA, is responsible for the destruction of the synovial membrane by the immune system. So it's an autoimmune disorder. The immune system is attacking itself within the joints, and it does produce joint inflammation. Typically, the small joints of the hand, feet, knees, and wrists and elbows are affected. Signs, again, morning pain, and stiffness, any type of pain that lasts longer than an hour, and is not relieved by kind of getting up and moving around and increasing your physical activity. Rheumatoid arthritis is influenced by cold temperatures and barometric pressure. So patients that live in cooler climates, or when the winter time hits, they tend to suffer from their rheumatoid arthritis symptoms more during this time. So the goal of therapy for RA is to maintain mobility and to delay the disability of that. The roles of the medication for rheumatoid arthritis are to improve the symptoms, or the ailments, so the stiffness and the pain and all of that, to increase the function of the joints and to help slow the progression of the disease. So disease-modifying anti-rheumatic drugs are DMARDs. These are a specific class on their own. They work to slow the joint destruction that actually creates the disability. The biologic response modifiers inhibit the lymphocytes and the cytokines. The therapeutic use is to maintain the disease and provide symptom control. And it does work best when started within the first 3 months of a patient getting an RA diagnosis. So the names of the DMARDs can be difficult to learn. It may be helpful that to remember that any generic names of the biologic DMARDs end with MAB. This is an ending abbreviation for monoclonal antibody, which is produced in a laboratory molecule designed to mimic the antibodies of humans. So the MAB part, when you're looking at the generic names, it's that suffix of the name to pay attention to. So if you look at slides 33, you'll see that that is the case. Okay, cyclophosphamide, azathioprine are also DMARDs. They work all different ways in trying to prevent the progression of the disease. So hydroxychloroquine is something that you've seen in the news heavily right now. It's one of the drugs that is in a clinical trial to see how well it does to treat COVID-19. One of the concerns is that we have a large amount of patients that are on the hydroxychloroquine, or Plaquenil is the brand name. And if this does become a approved treatment for COVID-19, increasing the access or increasing the production of this drug so it doesn't pull away from our RA patients who take it on a daily basis. So systemic lupus is a chronic autoimmune disease that affects the joint, skin, kidneys, lungs, nervous system, membranes, and other organs. It's characterized by periods of acute relapses and remission. General symptoms include fatigue, fever, and weight. Organ-specific symptoms of systemic lupus are arthritis, skin lesions, Raynaud's phenomenon, kidney dysfunction, pulmonary dysfunction. They can have ophthalmic issues. Chloroquine, again, is another drug they're looking at. It's very similar to the hydroxychloroquine. It decreases autoantibody production. It protects the skin and improves the lesions that systemic patients or lupus patients will get. Gouty arthritis is a deposition of sodium urate around a joint. It occurs in tissues, joint cartilage, earlobes, and the metatarsals. Uric acid metabolism, so it's an overproduction of uric acid and an under excretion of uric acid. So your body is overproducing uric acid and your body is not excreting enough of that. So signs include pain, swollen red joints. Typically the big toe is the first to be affected, and it is extremely painful. So predisposing medications, so what they would use to help treat gout: cytotoxic agents, diuretics, ethanol, nicotinic acid, and salicylates. In the past, gout was referred to as the disease of kings. This moniker came from the diseases associated with rich food and alcohol consumption, which were goods during that time that were pretty much only available to the wealthy. So acute gout treatment. The pain is the worst in the first 24 hours of the attack. Usually resolves in 3 to 10 days with medications. The NSAIDs are used for the pain and the swelling. Colchicine decreases the swelling and uric acid deposits, so that helps with that. Allopurinol, probenecin, they all work with decreasing the levels of uric acid in the body. So acupuncture. So we're looking at complementary and alternative therapies, so non-prescription. So acupuncture has been used for many centuries to help with pain. Acupuncture involves penetrating the skin with needles in specific areas. Chondroitin. Chondroitin is an over-the-counter supplement that is usually used in combination with glucosamine for knee or hip osteoarthritis. The effectiveness of the combination is not very clear, but they think it works by inhibiting an enzyme that produces the inflammation. A typical dose of chondroitin is 200 to 400 milligrams 2 to 3 times a day, and there are some side effects of nausea, heartburn, diarrhea, and constipation. So you'll find if you work in any type of pharmacy retail setting that a lot of patients will come in and purchase these supplements over the counter, and most of the supplements are actually a glucosamine and chondroitin combination, so it has both drugs inside the capsule or the powder or however it's available. So the glucosamine is used to improve the pain and stiffness from osteoarthritis. It's also thought to slow the disease progression or the joint degeneration. Sorry, I can't talk this morning. Patients that have shellfish allergy should avoid taking glucosamine because it can spark that anaphylactic reaction. The typical dose is 500 milligrams 3 times a day. Same side effects as the chondroitin, but they also recommend that you take the glucosamine with food to help decrease GI upset. Willow bark contains salicin, has been used to treat many different types of pain, including osteoarthritis. There are comparative studies with traditional agents on whether those drugs are you can take willow bark with certain drugs. So again, you want to make sure that if a patient comes asking for that type of thing, that they see a pharmacist to make sure that they don't potentially have any drug interactions with the willow bark. And that completes chapter 13. So if you have any questions, make sure you reach out to me. You can call me, you can email me, and I will get back to you very quickly.